surgery, I put on loose-fitting clothing. They told us it had to have like a zipper or something that's easy to take off and put back on. I have my slippers and I'm pretty much ready to go. My appointment is at 10 a.m. It is currently 8. We're like probably 30 minutes away from Huntington Beach, and I'm currently right now in Long Beach, California, getting it done with PSI, Plastic Surgery Institute of California, with Dr. Hakeem. And I'll keep you guys in the loop of how it's going, okay? And then I'll try to record as much as possible so you guys can see how the procedure goes, okay?
So today, my beautiful wife is about to go get some boobs. She's about to get the surgery today. How you feel about that?
I'm nervous.
Ooh.
I'm excited though. I'm here for my surgery at 10.
Checking in?
Yes.
What's your name?
Jennifer.
Last name?
Vega.
Oh my gosh, you're so tiny. I love it.
I know, I'm kind of nervous and excited.
You're gonna do great. Don't worry about it.
Thank you.
Okay, so I have a few questions for you, okay? Have you had a cough, shortness of breath, or difficulty breathing?
No.
Have you had fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell?
No.
Have you had COVID?
No.
Have you been out of the state or country?
No.
Have you been exposed to anybody exhibiting symptoms for COVID?
No.
Perfect. Alrighty, and then can I see your ID, hon?
Yeah.
Thank you. Alrighty, so go ahead, come in, have a seat.
Okay.
Or is he gonna stay with you?
Do you want to stay with me?
It's up to
Is
you.
it recommended?
He can sit with you until you're done with your paperwork, because I'm gonna give you a stack of paperwork to fill out, and then this way he can kind of sit with you and keep you company.
Okay, yeah, let's do that.
Okay, I'll go ahead and have a seat right out here, and then I'll go ahead and get you your paperwork. I'll bring it to you. Do you have any allergies?
No, I don't.
What about tele tips?
Not that I know of. I'm good. Thank you. Alright, so we gotta wait. Changed right now. I'm gonna go ahead and bring me a blanket, and we're gonna go into surgery in a few minutes. So yeah, bye.
Just gonna leave this here. Alright. Perfect. And I'm gonna be taking a look on both sides to see which side is best.
Okay.
We're gonna open everything up. And then as for the instructions, just after this, make sure that you have somebody who will be with you for the first day or two. You're gonna wanna, you're gonna be a little loopy, kind of drowsy for the remainder of the day today. So just so you know,
Okay.
not doing anything that requires your full alertness for the next 24 hours as well. Apart from that, when you get home, just make sure that before, laying down or anything like that, you have at least 2 pillows behind your back when you sleep.
Okay.
It'll make you more comfortable. And whenever you get up, try to use your stomach, like to bring yourself up, kind of cross your arms. That way you don't use your arms.
Okay.
We don't want you pushing, pulling, lifting anything more than 10 pounds. So just try to basically forget that you have arms for the first couple of days. Okay.
Okay, sounds good.
And you're going to be following that for 2 weeks.
For 2 weeks?
Yes.
Okay.
Okay. Any questions with that so far?
From home, and I have a desk job. Would you say that I shouldn't go back maybe in another week, or?
It just depends on how you feel.
Okay.
Just If it's a desk job, it should be okay.
Okay.
But again, like, see how you feel, because sometimes the medication might make you a little groggy, a little sleepy.
Okay.
So just depending on how you're doing with that, then you know you'd be okay to work.
Okay, sounds good.
Besides that, you are going to be having some medications afterwards. You're going to have some pain medication, some antibiotics, a muscle relaxer, and then something to help prevent nausea.
Okay.
The nausea one is just in case. If you were to feel a little nauseous, if you don't feel nauseous, you don't have to take it. But the pain medication for sure, you will be taking that for the first couple of days. All right, babe, let me take a look at this one right here. One thing to note is just the pain medication and the muscle relaxer. Try to take them at least 1 hour apart. You don't want to take them together because in combination it'll be too strong.
Oh,
We
okay.
just don't want you to be too out of it.
Yeah, no,
Okay.
I don't either.
Yeah. So just see how you feel, and then just take the medication as directed. It has it on the bottles, okay?
Yeah, it does. Okay, awesome.
And then we'll go over that stuff with your husband as well afterwards.
Thank you so much.
You're welcome.
I'm so excited.
I'm excited for you. Alright, let me pop this up here. Step to this side. Any questions with the instructions?
No,
so
I'm
far?
glad I'm recording because I get to go back and hear everything you just said.
Okay, good.
Yeah, it's gonna be very helpful.
Alright, so let's clean it up. So just nice big deep breath in and out. Big poke here, I apologize. Yeah. Sorry, I get to be the mean one and poke you.
You're fine. I just closed my eyes. I have tattoos, so you're good.
All right.
I'm not a weenie when it comes to needles, huh?
Well, that's good to hear. You did great. We are gonna put a couple pieces of tape here.
And we're done with the IV. How do they look?
Look great.
Yeah. They're swollen though, really bad.
Very swollen still, yeah. It'll take a little bit before they can go back to where they need to, but they look fantastic.
Yay.
Did he have to like cut the skin from the bottom?
He did not.
No.
Yeah, he went through the areola
Oh,
to
okay.
place the implant.
They are hella stiff right now, but this is kind of how they look. I got 450 cc.